Good afternoon. My name is Mary Christopherson. I'm here with Andy Keto, a nursing director at Bridgeport Hospital. We are here to talk to you and share with you the virtual nursing program, which is an innovative and transformative initiative aimed at revolutionizing nurse staffing team collaboration. This project seeks to leverage technology and virtual platforms to enhance care delivery, improve nurse-to-patient ratio, foster effective teamwork among healthcare providers. I have with me our Bridgeport team, which you will meet, and our system partners to share the virtual nursing program, what it is, how we implement it, and the positive impacts from different perspectives. Andy?
Sure, thank you. Good afternoon, everyone. So we started this virtual nursing program or journey about early 2023, and we actually went live on 2 units at the Bridgeport campus on April 2023. So we started with 1 virtual nurse, and the vision was to expand the program to cover all 9 med-surg units at the Bridgeport campus. So right now we currently have 11 virtual nurses active. And we've been able to leverage the existing technology that we have in our campus. During COVID, we implemented a lot of technology that it wasn't being used to its fullest capacity. We were able to leverage that existing technology and roll out our program, which, like Mary said, supports our patients, our staff. So some of the specifics that I can go into is the ratios. Our virtual nurses support anywhere from the ratios 1 to 50. And they are deployed in a capacity to do 2 virtual shifts and 1 clinical shift, which is something that we came up with in order for them to build stronger relationships with our patients, with our units, and with our team members. So as I stated, we initially rolled out in April 2023 on 2 units, Northwest 7, a medicine unit, and Northeast 10, a cardiology med-surg unit. And I have with me Courtney McMorris, manager of Northeast 10, and Kara Burdick, manager of Northwest 7, to share a little bit of their perspective of the virtual nursing program.
Thank you, Andy. So when we were first asked to pilot this program, we were very excited, but there was also a little reluctance and hesitancy that we had to overcome. Staff, for the first time, we were going to share the responsibility of doing a discharge with somebody that they may not even have on staff in the building with them. And our patients weren't quite comfortable at first with the idea of someone they hadn't been working with coming in and saying, I'm here to go over your discharge teaching. But we quickly found that reluctance was changed to acceptance and embracing it.
One thing I always tell everyone is this truly was one of the easiest pilots we've ever done. You know, as Carrie mentioned, there's always a little bit of reluctance on part of the team when we're rolling something new out. It's a change, it interrupts their workflow. But day one, as soon as we started with the virtual nurse, it went so seamlessly. And we started off having daily check-ins with our IT team, our nursing leadership, and we pulled the virtual nurses into that as well so we could have their input. So we quickly worked through any roadblocks that came up to really make the process as seamless as possible. And really then it became this wonderful tool of discharging our patients, helping them to be informed.
Absolutely.
Hi, my name is Jamie. I'm one of the virtual nurses. I'm going to go over your discharge paperwork with you. Am I speaking to Mrs. Smith?
So when we started this, we decided we needed to have a roadmap of what the ideal discharge looked like so that it was standardized and everybody was receiving the same plan. So what Courtney and I did is we worked with our team to say what's important when you're doing a discharge. What does the patient want to get out of that experience? We started with looking at the care plan, the important teaching with medication, but what happens when the patient goes home? What do they need to know to be successful at home with the services they're going to receive and have that real opportunity to ask questions without being interrupted and feel like they're having that dedicated time that they need with the discharging nurse? In order to do that, you have to have a nurse that's comfortable with all of those aspects of a discharge. And to be honest, you need to have that perfect seasoned nurse that can come in on the spot and answer those kind of questions. So it's very important to us that we hired the right team to do that. So I'm going to ask Courtney to explain how we did that.
Sure. So to spin off of what Kara was just saying, we truthfully were quite selective about the nurses that we hired into this role because we needed them to be seasoned for our patients, but then also for our teams. I think it's widespread knowledge at this point that the nursing world is struggling a little bit with staffing and having seasoned nurses at the bedside. So any support we can have for our teams to help those nurses with any knowledge gaps, provide that teaching to the patients, another team support is so essential. So what's been really great is we've created this position as a hybrid model, which, as Andy was saying, the virtual nurses are on our units 1 day a week. So they're really becoming part of the team. So that's so helpful too when one of our nurses needs to discharge or admit a patient, and they're able to pick up the phone and call a nurse who they know, who they work with regularly. So this helps as well with our novice teams. We struggle a little bit with retention, employee engagement. So having another seasoned team member there to support is really helping in these areas as well.
So Courtney and I are on site at our virtual nurse headquarters at Holly Lane, and we'd like to take the opportunity to introduce you to 3 of our star virtual nurses.
So here we have Tanisha, and next down here we have Jess, and then down here we have Jamie.
Hi, my name is Jamie. I'm one of the virtual nurses. One of the concerns about the program was that it would feel impersonal, and I can tell you from my own experience that I've taken care of patients on the unit. I've taken care of one patient on the unit where I knew I would be discharging them the next day, and I can tell you that both the reassurance of seeing somebody that they already knew and somebody they already had a rapport with made for a very good patient experience for them, and actually wound up making it more personal rather than impersonal.
Hi, I'm Jess, and I've been substituting as a virtual nurse while I've been out with an accommodation for a herniated disc. And I've realized how great of an opportunity this is to continue supporting patients and the nursing team and working full-time while I've been out with this accommodation.
Hi, my name is Tanisha, one of the virtual nurses here, and I think this is such a great program. It supports our nursing staff, and it's a real great tool to assist the patients.
Hi, my name is James. I'm the inpatient program manager for Yale New Haven Health System, and I'd like to tell you about the future of telehealth technology at our inpatient spaces. Over here I have a device here that has a camera on the top and a camera on the bottom. This is a device that can utilize virtual nursing and virtual sitting functionality at the same time, as well as a lot of other things. This is a device that in IT we would like to call future-proofed. It is very state-of-the-art hardware that can last us a very long time. This camera up here can be utilized by virtual nursing. It can swivel in a 360 degrees. It can zoom in to the pupil size of a patient's eyeball that's about 20 feet away in the patient's bed. It can be utilized for a lot of workflows that we would like to implement with this technology, such as dual nurse med sign-off, looking at dual nurse skin checks, eliminating the need to bring a second nurse inside to the bed. This technology can also bring interpreters into a patient visit, so no more searching around for an interpreter cart on the floor. You can just beam that interpreter right into the television screen. As you can see, the TV here has a picture-in-picture of what the bed where the patient would be on the bed, and then it would also have the clinician on the screen as well, with their name up there on the top left to be able to conduct that visit. So this is the future of inpatient telehealth. We're really excited about it. We think it opens up a lot of opportunities to provide a lot of benefit. We think this will improve our patient care, improve our staff satisfaction, and overall just a general ability to provide care.
I'd like to take a minute to really thank this entire team, including James Flaherty as our system partner, for the ability to transform a vision into actuality, supporting the patients and the care that we deliver. Thank you all very, very much for everything, and looking forward to greater and more expanded telehealth nursing, virtual nursing across our system.